This programme is, as far as we know, the first programme of its type that has specifically looked at providing end-of-life and palliative care training for allied health professionals, because the training has tended to be focused on sort of medical and nursing staff, and AHPs attend it, and a lot of it is very relevant. But these courses are different because we've actually looked at what the needs of AHPs are in relation to palliative and end-of-life care. To run every other month, starting at the end of April. They're going to be hour-and-a-half sessions, so they're very accessible sessions for people, focused on an education rather than a networking event. And the sessions are varied. There's one which is called Work, Rest and Play. That's looking more at things like the life balance and how important that is for well-being in patients who are living with life-limiting conditions. And that's also going to look at things like returning to work and the value of activity, because it's, you know, people are living longer with palliative care conditions, so they are looking at going to work and how do they work and still maintain their health and maximise their health. So we'll be looking at that side of things. Got one on facilitating motivation and behaviour change, which would be relevant to any healthcare professional, not just to an allied health professional, an OT or a physio. Another more medical one, which is a guide to pressure relief and pressure management. And then another one which is called Quick Fixes for AHPs, which is, we were asked specifically to provide some training for AHPs who are very involved with trying to prevent hospital admission at end of life and keep people at home, and also trying to facilitate fast discharges when people want to have their preferred place of care at the end of life is home. So it's looking at getting people together and looking at the quick fixes that are available, the things that we can do really quickly, to top up our sort of clinical toolbox, really, of things that will really help people quickly to get these things sorted for their patients. So that's the bite-sized sessions.